Good afternoon. My name is Flavia. I am one of the co-founders of Presixion, an accessible healthcare diagnostic startup. Before I tell you about Precision, I want you to meet the man on your screen. His name is Rodolfo. In 2021, he joined his family for Christmas dinner. What none of them knew was that someone at the table was an asymptomatic carrier for COVID, and within a week, Rodolfo and seven others had passed away, one after another. The family in this story is my family, and Rodolfo was my uncle. When you lose eight family members in a split second, you start to wonder what went wrong, what failed them. This is what healthcare looks like in rural Peru, waiting in long lines under makeshift tents. Actually, one in four Peruvians has lost a family member to a respiratory infection, yet access to diagnostic remains critically limited. For every 45 healthcare facilities, only one of them has diagnostic testing available. And this isn't just in Peru. In fact, one in 50 healthcare facilities in developing countries can screen for infectious diseases. So we asked ourselves, why is it so hard to access care in these areas? And to answer that, we partnered with local healthcare workers to conduct a market discovery survey across remote regions of Peru. We found that 77% of patients delay care mostly because it's too expensive or the hospital is just too far. On top of that, the system is deeply fragmented with so many different groups running local clinics. Resources are stretched thin and coordination is nearly impossible. And at the national level, funding often misses the mark. Outbreaks are overlooked, and support really doesn't reach the places that it's needed the most. So we knew we had to create something simple, not complex, something that is robust and can be used in various geographies. And most importantly, something affordable. The team at Precision answered with an inexpensive paper-based sensor for rapid pathogen detection. You simply swab, stir, and drop, and within minutes, you'll have results. And unlike traditional diagnostic tests, which can range anywhere from 400 to 1,000 even for whole genomic sequence, ours range from $3 to $5 per test. Additionally, in many of these developing countries, it's not just about the money. These regions often lack electricity, trained personnel, and reliable infrastructure. Precision tackles this. Our tests are portable, they're durable, they don't require electricity, they don't require temperature-controlled sample storage, or to hire someone to make a lab. So, how does Precision work? We operate on a twofold system. First, we distribute test kits to clinical health facilities through partners like public health departments and medical NGOs. Test results are uploaded to our secure off-cloud database. Then our public health agencies can subscribe to these databases, giving them real-time epidemiological data into outbreaks and helping them respond faster to emerging disease hotspots. Peru is just one of many developing countries where access to diagnostic testing is still out of reach. But in Peru alone, over 10 million people rely on 5,600 underfunded health facilities. Our initial focus is on high need CHF serving about 2 million people, a $6 to $10 million opportunity. Our hope is to grab just about 5 to 6 of those CHFs for clinical trials, each seeing around 10,000 patients a year. As adoption grows, so does the value of our real-time data platform. And we can't do this without the invaluable help from our partners on the ground. We have Dr. Cesar Romal, Director of Hospital Regions in Loreto, Peru, and Dr. Alberto Mendoza, Medical Director at Socios en Salud, one of the top medical NGOs in the area. And we're also hopefully to future partner with UMD's MIPS programs for prototype development. We started out small. This year, we've been really busy. Our team secured support from Yale, NSF, and Cornell, and this spring we plan to begin prototype validation. And by 2026, we'll launch our first small-scale clinical trial in Peru with the support from our existing partners. So meet the team that makes the magic happen. I'm Flavia, a bioinformatics researcher with 7 years of experience in the infectious disease space. But we have a diverse team with backgrounds from Yale, Cornell, UMD, George Mason, and that brings together an expertise in bioengineering, clinical care, and business to drive the mission forward. And we thank you for giving us a space to talk about our crazy mission. And we thank you so much for hearing us out. We'll be happy to answer any questions as well.